Welcome to the CAMPS Center for Advanced Manufacturing Puget Sound Group Medicare Advantage Plans presentation. This program is available for individuals who are at least 65 and are retired or once worked for a CAMPS member company. Individuals who are at least 65 who are not benefit eligible working for a CAMPS member company may also be eligible for this program. In this presentation, we will review the CAMPS Group Medicare Advantage plans available and subsequent steps in how to enroll. Regions Group Medicare Advantage plans. Like the Medicare Advantage plans presented in the Medicare 101, these plans replace original Medicare as the primary payer of Medicare A and B services. These Med Advantage plans include Part D drug coverage, extra benefits such as dental, vision, and hearing aids, an extensive nationwide PPO provider network to pick a provider from, lower premiums than Medigap plans, one ID card for all covered services. The Regions Group Medicare Advantage plans have a unique advantage when compared to other non-group retiree advantage plans. The plan can be purchased even if you live outside of Washington state. The plans are portable. If you move counties or to another state, you can retain the plans. They have continuous open enrollment, allowing one to enroll any time of the year. If you decide to make a change in the future, you have a special enrollment period that offers you an opportunity to secure a Medigap or supplement plan. With group Med Advantage plans, you are still required to enroll in Medicare A and B, and you must continue to pay your Medicare Part B premium. The CAMPS 2024 Regions Group Medicare Advantage Retiree Plans. There are two plans to choose from. First, the Regions Med Advantage plus RX Primary PPO. This has a $0 per month premium. Second, the Regions Med Advantage plus RX Classic with comprehensive dental PPO. This plan has a $66 per month premium. Who is eligible for these special plans? A Medicare-eligible retiree who at any time has worked for a CAMPS member company. A Medicare-aged employee working for a CAMPS member company who does not work enough hours to be eligible for their group benefits. Eligible dependents, which include a retiree's Medicare-eligible spouse and Medicare-eligible unmarried children. And members can live anywhere in the United States, not in U.S. territories, and members must be enrolled in Medicare Parts A and B and continue to pay their Part B premium. These plans offer nationwide coverage. Members can travel and live anywhere nationwide. Members can use a contracted PPO network provider in any of the blue highlighted states and receive in-network benefits for non-urgent services. It's available in 48 states, Puerto Rico, Washington, D.C., and the U.S. Virgin Islands. Outside of the Blue Medicare Advantage PPO network, service area retirees get in-network benefits with providers who accept Medicare. No referrals are required. For details, please visit regents.com/MRG. Which plan might be best for you? In the following slides, we will take a look at the Med Advantage plus RX Primary with a $0 premium and compare it to a Med Advantage plus RX Classic, which has a $66 premium. A couple of housekeeping items. Moving forward, I will reference the two plans as primary and classic. Our focus will only be on the in-network benefits in the review of these plans. Both plans have a zero deductible, and the annual out-of-pocket maximum is $6,700 for the primary and $5,900 for the classic. Continuing line by line. Both plans cover physician primary care visits at a $0 copay. Specialist visits such as cardiologists, dermatologists, orthopedics, etc. are a $45 copayment under the primary plan and a $35 copayment for the classic plan. Behavioral health visits are a $30 copayment with the primary plan and $25 for the classic. Both plans offer telehealth services at a $0 copayment. What benefits are important to you? Continuing on. Outpatient surgery in an ambulatory surgical center is a $300 copayment with the primary plan and a $225 copayment for the classic plan. Outpatient surgery in a hospital is a $400 copayment with the primary plan and $325 for the classic plan. Inpatient hospital is a $410 copayment per day for days 1 through 5 under the primary plan and a $375 copayment per day for days 1 through 5 under the classic plan. Urgent care is a $45 copayment with the primary plan and a $40 copayment for the classic plan. Emergency is a $100 copayment with the primary plan and $120 for the classic plan. Ambulance is a $300 copayment with the primary plan and a $275 copayment for the classic plan. Is alternative care important to you? Acupuncture and chiropractic care is a $20 copayment with both plans. Please note the primary plan only covers Medicare covered services. The classic plan covers additional with a combined limit of 15 visits for chiropractic. Naturopathic care is a $20 copayment with both plans. Massage therapy is not covered under either plan. Over-the-counter supply allowance, there is none with the primary plan, and a $20 per quarter allowance with the classic plan. Hearing exams using True Hearing are covered the same in both plans, with a $0 copayment. Hearing aids using True Hearing are covered the same in both plans, with costs ranging from $699 to $999 per hearing aid. Vision exams using the VSP network are covered the same in both plans with a $0 copayment. Vision hardware using the VSP network are covered the same in both plans. Frames or contacts have a $100 allowance per year, and lenses have a $0 copay. Benefits are once per year. Let's look at dental. Preventive dental is covered the same in both plans with 2 visits per year and are covered with a $0 copayment. Comprehensive dental, which includes things like crowns, dentures, fillings, and extractions, are not covered under the primary plan and are covered at 50% with a $1,000 maximum under the classic plan. There would be no waiting periods for the comprehensive services under the classic plan. Part D, prescription drug coverage. Prescription benefits. Fill prescriptions your way. Preferred pharmacies include Walmart, Rite Aid, Albertsons, Costco, Walgreens, Kroger, Safeway, Amazon PillPack, and many more. The mail order pharmacies, Alliance RX Walgreens Pharmacy, Express Scripts Home Delivery, and Postal Prescription Service. There are additional pharmacies available. These can be found at regents.com/MRG. By the way, note this website because if you're traveling, it might provide a good resource if you need prescriptions filled. The formulary, there's an approved formulary list, and it can be found at the same website, regents.com/MRG. Lastly, if you ever need assistance, the Regents Medicare Customer Service line is available at 888-319-8904, typically open 8 to 8 Monday through Friday. Get extra value from your drug coverage. $0 copays for preferred generic drugs. Pay nothing for Tier 1 generic drugs when using a preferred retail or mail order pharmacy. $0 RX deductible plan options. Your coverage starts right away for prescription drug coverage on select plans. Free vaccines. Covered Part D vaccines are available at no cost to you. Use insulin. Pay $35 or less per month for insulins with no deductible at any pharmacy or supplier, even for those using insulin pumps. Get more for your money. Get up to a 100-day supply of your drugs at the same copay as a 90-day supply. Let's look at the drug benefits associated to each plan. This table shows how medications would be covered in the initial coverage stage. After the deductible, the amount the beneficiary pays until you and the plan reach $5,030 for covered drugs. In comparing the annual prescription deductible, the primary and classic plans have $0 deductibles for medications that are listed in Tier 1 and 2. The primary plan has a $250 deductible for medications listed as Tier 3, 4, or 5. The classic plan has a $150 deductible for medications listed as Tier 3, 4, or 5. Medications in Tier 1 and 2 for mail order, up to a 100-day supply, are covered at a $0 copayment. Medications that fall in a Tier 2 generics, Tier 3 brand, and Tier 4 non-brand copays will be the same between the primary and classic plans at $13, $40, $100 respectively at a preferred retail pharmacy. Tier 5 specialty medications, a member would pay 28% under the primary plan and 30% under the classic plan at preferred pharmacies. Let's look at the stages of Medicare Part D drug coverage. Stage 1 is your deductible. Member pays the full cost until the deductible has been met. Stage 2, the initial coverage stage. Member pays a copayment or coinsurance for each prescription. The initial coverage stage continues until total drug cost by the member and the plan reaches $5,030. Stage 3 is called the coverage gap. The member pays no more than 25% of the cost for brand name and generic drugs covered by the Part D plan. Please note, the full cost of the drug will be used to move you closer to the catastrophic stage. Stage 4, catastrophic. The member pays nothing for any drug on any tier, including insulins and Part D vaccinations, after you and your plan have paid $8,000 for covered drugs. Additional benefits. Silver and Fit, free standard gym membership at thousands of fitness center locations nationwide. Unlimited access to on-demand workout videos and live streaming fitness classes. Weekly one-on-one coaching sessions by phone, video, or chat included at no cost. There are more extra benefits and programs. There's a personal emergency response system, free medical alert device for 24 hours, 7 days a day assistance at a push of a button with monthly monitoring charges covered at 100%. The meal delivery services, free nutritional support for managing chronic conditions or after an inpatient hospital stay. This may include meals delivered directly to your door anywhere in the country at no cost. Are you ready to enroll? Do you have questions? Please feel free to email or call me, Mike Jackling. My phone number is 425-526-3469. My email is mike@PROBENEFITSWA.com. We look forward to serving you. Thank you.